Hello, this is Dr. Stanley Lang. Welcome to this broadcast. And the topic of question is it Lyme disease? And the symptom that we're going to be talking about is muscle pain. So if you've ever had a lot of muscle pain that doesn't go away, you can know how distracting, how bad that can be. And years ago, when people came in with diffuse muscle pain, the most common diagnosis that we were using at that time was fibromyalgia. We still don't really understand the causes of fibromyalgia when that diagnosis is being used. And one of the things, though, that I think many Lyme disease researchers have been concluding is that this fibromyalgia diagnosis has been Lyme disease all along. And in many cases, it probably is Lyme disease, at least with the patients that I see in the terms of how they respond to treatment. So I saw a patient recently who had been having just dramatic increase in muscle pain. He's been a healthy patient almost all of his life. And he had a minor issue that required him to take an antibiotic not too long ago. And he discovered that when he took this antibiotic, that his pain got better. So he came to talk to me about the situation. We talked about the possibility of it being Lyme disease and the idea that most of the time the usual Lyme test that is used in the United States is negative even with people that have Lyme disease. So I don't really use it unless patients request it. And so he went on a trial of medication using the antibiotic that was used for this other condition, since he felt better on it. And he did feel better for a while. And then even while taking the antibiotic, his symptoms slowly started to come back. And so we had a long discussion about what might be going on in what I still think is chronic Lyme disease causing his muscle pain. Now, there are a few blood tests that should be done to rule out other conditions, but these would be really pretty unusual in a man in this age group. So I explained to him that Lyme disease is difficult to diagnose in the first place, and second of all, it's even harder to treat because once the Lyme organism knows that it's under attack, so to speak, it changes into a form that makes it sort of invisible to the immune system, so the immune system is not engaged trying to attack it. And then after that, the organism can form colonies, which are called biofilm colonies, actually in the body, which become impenetrable to many of the antibiotics. So we talked about the alternatives, which would be to switch to a different antibiotic, one that is more likely to kill Lyme disease in the first place, or to approach it in a completely different way, which understands that part of the reasons that we're having so much Lyme disease issues is because our immune systems have been, and our GI tract have been so significantly damaged by environmental toxins. So I went on to explain that fixing his biome, that's the bacteria and other microorganisms that live in his bowel, that's his biome, fixing that, avoiding the toxins that cause damage to the biome, and using adequate, effective nutritional supplementation are sort of critical steps to help both the biome and the immune system recover, and then using a natural substance rather than an antibiotic to kill the Lyme organism. So basically, those are the two options. And so he's currently thinking about which one of those options he wants to try. For a lot of patients, unfortunately, who want to try antibiotics, they don't have access to somebody that's willing to prescribe them because their doctor thinks that they don't have Lyme disease because their blood test is negative. For those folks, that second option that I was talking about is really the only option they've got. Now, there are several different so-called natural Lyme disease treatment programs available on the internet. To the average person, it's going to be difficult figuring out which one should you try to use. I think there's a couple that are pretty good. But one of the problems that's in common with both of the two that I'm thinking of is that they take a long time to get a good result. The natural program that we've developed actually takes a short time to see a significant result for a significant percentage of people. And we've been seeing improvement in people, even with memory loss as a result of Lyme disease, people with diverse neurological conditions and muscle pain and just fatigue seem to be responding to this natural program. So if you'd like to know more about whether you think you might have Lyme disease, you can click on the link below or beside or maybe on this video to get more information about, do I have Lyme disease? Is this Lyme disease the symptom that I'm dealing with? And if you are convinced enough that you might have Lyme disease, I encourage you to get the program, because it will help you in a lot of different ways, even if you don't have Lyme disease, because there's so many healthy things that you're doing for your body. But if you do have Lyme disease, it's even more likely to be helpful. So I wish you well, God bless, and have a great day.